you know, a couple of years ago, going to the emergency room, you would never get out for about, seemed like a half a day, a half the night.
Since 2006, the public has been made aware of emergency department problems and issues through the national media.
More than 240 minutes. That is the staggering average wait for patients in Maryland's emergency rooms.
At this very moment, 5 emergency rooms in our area are under yellow alert. That means they're so overloaded they can't see most new patients. By the way, this is not one of them.
On any given day, we see roughly 155 patients. In the past, at noon or so of any day, we would have patients lined up along the hallways here. Now that we have a new space, FlexCare, we're able to accommodate the increased volumes.
So when I came in, she was already in the room there. They did her vital signs and everything.
At Union Memorial, we've been able to take a new space, and we've termed that space FlexCare. FlexCare is a combination of a pediatric care unit, of a walk-in urgent care center, as well as for a place for minor illness and injury. The unit is roughly 11 beds, staffed with nurses and board-certified physicians, as well as physician assistants to care for those individuals, patients, who have less than life-threatening illnesses or injuries.
Before we opened FlexCare, the waiting room would be packed. Sometimes there wasn't a wheelchair to offer a patient. There wasn't a chair for them to sit in. They were standing, leaning against the walls, and you know, they were up at the desk, when am I next, when am I next? Now with additional 13 beds, you keep the patients moving through the system because you've got available beds.
We've been able to decrease the throughput time by over 20% for patients coming through on average. It's gone from over 2.2 hours to less than 1.8 hours on average.
You know, it's been fast. I have no problems.
Our FlexCare unit has increased our patient satisfaction. It's decreased the congestion in the waiting room. It's decreased the congestion in the hallway.
It's been great. I have no problem whatsoever. The doctor and everybody's been great to us.
My name's Jennifer if you need anything else, okay?
She can take some pain. She's a trooper. That's why I love my grandmother. Right, Mama? Yeah.